The gentleman from Fairfax, Mr. Surovell.
Mr. Speaker, I rise for a point of personal privilege.
The gentleman has the floor.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, we've heard a lot of Medicaid speeches so far this session. I expect we're going to be hearing them until this session's over and perhaps afterwards. I've disagreed with what I've heard about some folks' perspective about this issue. As a business owner, my perspective as the owner of a business that employs about 36 people is very different from what we've heard. I could also talk to this issue about being somebody who represents a suburban district with a large amount of low-income residents who could really benefit from this, but I'm not going to talk about this issue from that point of view. I want to talk about this issue a little bit as a Virginian and as a 12th generation Virginian. You know, there are 12 men, no women yet, 12 men out there on Capitol Square. General George Washington, Governor Congressman William Smith, there's Dr. Hunter McGuire, the Civil War surgeon, Stonewall Jackson stands out there, but also we have Governor Harry F. Byrd Sr. And Harry Byrd means a lot of things to a lot of people, a lot of different things to a lot of people. Whenever I walk by Governor Byrd, among other things, one of the things I always think about is my grandparents. My grandparents grew up in Franklin County, Virginia, in poverty. They were 10th generation Virginians. My grandmother once told me that they got a banana for Christmas, and that was a luxury. My granddaddy talked to me about the Great Depression and what that meant to him. They talked to me about they were farmers for a long time. And they talked about how when they were children, if they wanted to get from the farm to Roanoke, it would take a full day in a wagon because the roads were mud. They had to ford rivers, and it would take a day in. They'd sell their vegetables, and it would take them a day to get back. My grandparents went to school in a one-room schoolhouse, which was paid for by the local farmers. They could only go to school through 8th grade because we didn't really have a public school system back then. And my grandmother was one of only 2 out of her 7 siblings that was able to go to high school because that was all my great-grandfather could afford. And during the summers, my parents used to send me down to Franklin County to go fishing. My granddaddy had a cabin on a lake. And my brother and I we really like to fish. We like to go down there and help them pick up vegetables out of the garden and spend time with my grandparents, which I remember to this day. And a lot of those long drives back and forth from their home in Vinton back down to their home place, they used to tell me stories. And one of the stories they used to tell me, I didn't talk to my grandparents about politics too much, but one of the things they always talked about was Harry Byrd. They didn't talk about massive resistance. They didn't talk about the things he was known for later in his career. What they talked about with regard to Harry Byrd was about how he and the government of Virginia changed their life. What Harry Byrd, folks, became known for was that he was the father of our modern road system. He implemented our gas tax. He created the Transportation Trust Fund. My granddaddy told me he just could never believe that he could ride in his car from Roanoke to his home place and back, and it would take 30 minutes one way. They would just shake their head. My grandmother used to talk about the same thing. They used to talk about how Harry Byrd created our modern education system in Virginia. He did that when Virginia enacted the income tax and the estate tax because Harry Byrd thought it was unfair to tax only working people's income, but not the income that the wealthy people get to defer to their kin when they die. But Harry Byrd brought real improvement to Virginians' lives. He showed them that government can change people's lives, that government can improve your road system, can make it possible for people to do business much more easily, and it can lift people up through education. And they remembered that until they went to their graves. Now, when I look at this Medicaid situation, I see 400,000 Virginians that have been left behind all around this state. 400,000 Virginians that we have an opportunity to change their lives. 400,000 Virginians that don't have the dignity of the same health insurance that my family has, not because I'm a member of this legislative body, but because my wife's employer provides it to my family, or because my law firm provides it if I so choose it. And Mr. Speaker, this issue, I believe, just as education and just as roads was critical to my grandparents almost 100 years ago and their family, health care and health insurance is just as important to all of Virginia today. Last year, there was a study that came out in the Journal of Health Affairs. It said that in 1980, life expectancy of birth was 2.8 years longer for the highest socioeconomic group defined in a research study than at the lowest. By 2000, that gap had grown to 4.5 years. In other words, if you're well off, your life expectancy, the gap between the most well off and the least well off in our country, has grown in the last 20 years. That study also found that not only is life expectancy diverging by income level, but now some demographic groups, particularly low-income white women, are losing ground. And where are they losing ground? According to that study, women younger than 75 are dying at rates higher than before, and the counties where women's life expectancy is declining typically are in the rural South and West. And I would suspect if you were to look at that in the Commonwealth of Virginia, a lot of that would probably be in rural Virginia versus suburban Virginia. And Mr. Speaker, when I think about this issue and I think about the good we could bring to people, when I think about the dignity of life, I think that the dignity of life also means we take care of people once they're born, and we make sure that they can enjoy the longest life possible because they have the dignity of health insurance. They don't have to worry about getting preventative care. They don't have to worry about going bankrupt from going to the doctor. They go to the doctor before they get sick so they can live the longest life possible. From my point of view, Mr. Speaker, this issue is just as critical as education and roads were 100 years ago. We need to provide every Virginian that dignity that comes with being able to go to the doctor and not having to worry about how you're going to pay your electric bill. And I hope at the conclusion of this debate, at the end of this session, we can provide the dignity of health insurance for everybody in this state. Thank you, Mr. Speaker.